Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Okay. Hello and welcome to the Quality of Life podcast. I'm here today with Emily Stamey, Four Seasons Regional Director of Palliative Care. Thank you so much for joining us, Emily.
Thank you for having me.
I'm so grateful that you're going to spend some time with us, and really I hope our listeners can come away with knowing that if they have a need, if they're facing a serious illness, all they have to do is call Four Seasons, and we can provide trusted care for them. So when we think about your service of being a provider, of being the director, could you share with us just a little bit about yourself and maybe why palliative care connects with you?
Sure. So I live in Macon County, one of our far west regions, and I'm from there. That's where I work. I became a nurse practitioner in 2016.
Okay.
Before that, I was a critical care nurse at a critical access hospital. And after becoming a nurse practitioner, I worked in primary care for 4 years.
Okay.
So, my passion is patient-centered care. I'm not capable of giving any care that isn't patient-centered care. And that's what palliative care is. So it's just such a natural field for me to be in. And my strengths drew me to that. So like a lot of people, personal experience led me to go into nursing in the medical field. And when I was an adolescent, I had a parent who was sick, and I saw how difficult it was to navigate the healthcare system. The hardest thing for us to get wasn't medicine, but it was someone to talk to us and to communicate what was going on. And honestly, we did not understand that he was dying until his prognosis was hours. So, I saw that that wasn't a unique experience, and I saw that throughout my career in nursing. And it became my passion to really communicate with patients and their families and to empower them to really navigate their illness.
Yeah. Thank you for sharing that. As you were talking, I'm like, I would love for you to be my provider, and I want our listeners to know that everyone that you hire for your region or that's hired throughout palliative care or our entire organization, they have a similar passion to you. And many of us have stories. Right?
Absolutely. Everyone kind of has this mission-driven practice.
That's it.
And in palliative care, it tends to pull people in. We get to spend time with patients.
Yes.
My new patient consults are typically, I'm usually in the home for an hour and 15 minutes to 2 hours.
I love that.
Yeah, I do too.
Yes.
It's what I love most about my job.
Yeah.
So, when I go in, my goal is to get to know that patient, to know their family, and to learn what's important to them. So that's why I love palliative care. And it's, it's the medical specialty for me.
Right. Well, when you think about it, you take the time to get to know the patient and those most involved people, their loved ones. And I don't know about you, but there's lots of times throughout our life we might not feel like we're that most important person at that moment. But at Four Seasons, whomever we're providing care for or the part of their family unit, you are the most important person.
Absolutely.
Absolutely. And the care is uniquely yours. We want to know, how can we best provide care?
Yep. And our mission's co-creating the care experience, right? And it truly is. I do different things. Every palliative care provider does different things for each patient, and it depends on their goals of care. So my first visit and every patient after is determining those goals, and that may be being able to fish again in spring or seeing a grandbaby born. Or it may be to be as independent as possible and avoid the hospital.
Yes.
Some people want as many heartbeats on earth, and we make a care plan that works for them. So, I just love palliative care and our mission at Four Seasons.
I'm just so glad that you shared that. And, I want our listeners to know that regardless of what stage you're at in a diagnosis or your loved one is at, all you have to do is call Four Seasons. We can help you figure it out. Sometimes people receive a diagnosis and they don't know what to do. And so we have care navigation that can help. We have home care that can help. We have palliative care, hospice, grief support. And so what I want our listeners to understand today is that if you have a serious illness, what are your options? And so we're going to talk specifically about around pain. So one question is, some people think that palliative care simply means pain management. Well, we know that managing pain is one very important aspect, but there's so much that our palliative care has to offer. And so could you explain to us how palliative care relates to pain management and what else it might encompass as well?
Yeah, so we do manage pain in palliative care.
Yes.
Like you said, we do symptom management. I don't manage every patient's physical pain who I see. So we manage pain related to the serious life-limiting illness. So a lot of cancer-related pain, neurodegenerative disease-related pain. And sometimes when we see a patient, they have chronic musculoskeletal pain, right? So I want the best care for my patient, patient-centered care. And the best treatment of that is not always an opiate prescribed by palliative care. There are interventional pain management offices, and they provide medication, but they also do interventions like epidurals, branch blocks and rhizotomies, spinal cord stimulators, injections to joints. And those provide excellent pain relief and help people's functional status. So that's the best treatment for a lot of patients. So I have patients who I actually see in palliative care who also go to pain management for treatment of their chronic pain symptoms for those interventions. A patient that comes to mind, I have a patient with sarcoidosis of multiple organs. She goes to pain management for care of her chronic back pain from spinal stenosis and degenerative disc disease. She gets those interventions I mentioned. She gets each of those interventions I mentioned. And I do give her low-dose opiates, but not for her pain because that's well managed. I give her that for air hunger from COPD and sarcoidosis. So, you know, whenever we evaluate you, the provider evaluates you, we look at your goals of care, what's causing your pain, and we make a treatment plan that's best for that patient. In partnership with that patient. Another thing that sets us aside in palliative care, when we say pain, we tend to go to physical pain, which is where all other medical specialties go to. But I think of total pain. So physical pain, psychological pain, a spiritual pain. And we treat all of that. So we think of all the ways those impact the person and their physical symptoms. So it's a very holistic approach. And, you know, I talked about communication with the first question. I think that is the most effective tool I have as a palliative care provider and where I make the most difference. So I have a lot of patients who I do not prescribe medication to. Their symptoms are decently well controlled. Their primary care provider already has them on a regimen that works. So I'm often going into homes to see how that patient's doing, see what's changed since the last visit, talk about prognosis, discuss with their most involved people what I'm seeing, helping with complex medical decision making. You know, if I see something's getting harder, if it continues to get harder, what's our plan going to be? What's important to you? Filling out most forms, living wills, and really having that patient-centered plan helps patients more than just a prescription. So we don't have to necessarily give a prescription to make an impact.
One of the things that you said that's so important that I want people to realize is at Four Seasons, we care. We genuinely care. We care about the person. We care about their most involved individuals around them. And we want to provide the most trusted care as well. And so I hope our listeners have heard that today already, in that we're going to find out what's most important to you. And, you know, if we were to just envision for a moment the story that you shared about your loved one, how special is it now that you're giving back to say, I want people to be informed, I want people to be supported, and I want to care really well. Thank you for being vulnerable to share that story.
Yeah, and I'm really grateful for that story because it has led me down the path I'm on with, you know, fulfilling work and being able to give patients and their families options instead of just, you know, this is what comes next. I go to the hospital, I do this. And, you know, some of our patients in palliative care have longer prognoses, but some are really planning if they would want to transition to hospice, and planning for what they want those days to look like. And it's an honor to be able to help with that.
You know, it makes me think, my grandfather was one of our first patients served whenever we built the Elizabeth House, the inpatient unit. And he had the most tremendous care by our staff and volunteers. But not only did he receive tremendous care, we as the family, those most involved people, received tremendous care. And so I think what's so important is that we remember just the simple phrase of we care, because we care for all involved individuals. And so with palliative care, it's such a really testament to people coming alongside of you caring about you.
Absolutely.
You know, I don't know how many places you could go and find that total person-centered care, that focus on what matters most to you. And it would be pretty relieving to know that there's a provider, there's an interdisciplinary team that says, we want to find out what's most important, and we want to co-create a plan.
It is. It's the most impactful thing, I
Isn't
believe,
it?
that we do. That's the feedback I get from patients and their families. I tell patients, I want to know everything about you, and I want you to understand everything that you want to understand that's going on medically.
Yes.
So I can help the medical team understand what you want, and you understand where the medical team's coming from. So kind of like translators between the two is the way I view our role.
Yeah. Well, I think it can be so scary when you have a diagnosis or when you don't, when you have symptoms, to start doing a search on the computer. You know? And we're saying, you don't have to do your own search. You can call us and we can help you. You know, regardless of if someone's listening, they're like, well, I don't have a serious illness, but I've got some concerns and maybe I shouldn't, look it up online. Well, there are tremendous providers all throughout the area that we serve.
There are.
And so I encourage people, if you don't have access to a primary care provider, a specialist, if you have a serious illness, a palliative provider, end-of-life illness, hospice, just reach out.
Yep. And, one common thing is in palliative care, we'll all see patients who the patient doesn't know about their prognosis.
Yes.
They've not been told.
Oh, wow.
Oftentimes, other specialties may be reluctant to say that. And so that's where I think that communication piece
that's
and
huge.
Transparency is just so important. Another common scenario is we'll be seeing someone with congestive heart failure and they don't know they have congestive heart failure, So it just shows that there's a void there.
There is.
That patients really benefit from that support.
And they don't have to or need to try to figure it out on their own.
No.
They can just call us.
Yep.
And one of the things that I love so much about Four Seasons is that we're going to provide you with the very best care. But if what your needs are, we aren't able to meet, we're going to connect you with those throughout the community who can.
Yes.
And so that's where trust comes to be a part of our name, is we listen, we care, and we co-create.
I agree with that completely. I'm glad you said that because when our team gets a referral, the registered nurse takes a look at that referral to see how we can help. And if we say, oh, well, this patient may not, need palliative care at this time, she still contacts the referral source or the patient to put them on the right path, which may be care navigation.
Yes.
Or, following up with their primary care provider or another community resource.
That's so important. You've touched on this a little bit, but I wonder for those who are listening who are family members or most involved people, could you talk about how palliative care helps them? And some of the listeners might say, yes, I'm family, or yes, I'm most involved, but I'm also the caregiver. Right. So could you talk a little bit about how we provide care?
Yes. So our palliative care teams have medical providers, either a physician, NP, or PA that care for the patient. The registered nurse works from home to provide phone triage support, and there's a social worker on each team. So every patient sees a medical provider. On average, that's about once a month. Sometimes sooner if needed. Sometimes it's more spread out if the patient's more stable with less needs.
That's just a tremendous offering, by the way.
Yeah.
To know that you're going to have a provider with you on a consistent basis.
And we consult social work in when needed. So we do not have like CNA support, and it's different from home health and nursing care. But the big thing we offer with palliative care is that navigation we've talked about. Go in and determining those goals of, things seem to be getting harder. So when that happens, is our goal to call 911 and go to the emergency room? Or do you want to call us and us focus on ensuring comfort? And at any point, we can place hospice consults when appropriate, and that gets so much more care into the home by design, because the patients need that, right? And that's when you get the CNA support, the RN support. So having that plan in place, again, I say empowerment because it truly empowers. A lot of times you go into the home and these things have not been spoken. They do not know what their loved one wants, and we allow that to be said. We ask questions that otherwise likely would not be asked. And then someone from palliative care is on call 24/7. That does not bring us into your house, but it puts you on the phone with a doctor, PA, or nurse practitioner. And you can call in for any concern. I love that. Yeah, absolutely. And now our answer depends on that patient's goal of care, right? If there is a patient who has strictly life-prolonging goals of care, which is completely fine in palliative care, and there has been a sudden decline, our answer may be you need to go to the emergency room because it fits with your goals. When if it's someone who's more comfort-focused and there's signs of an infection, well, we might try to treat that over the phone and ensure that they're comfortable at home and plan a quick follow-up. So the response really depends on what that patient and that family is hoping to accomplish.
I love something that you also mentioned is it matters what's important to them. And so the approach may be different, and oftentimes is, because it's the approach that's most appropriate for that individual and for their needs.
It is. That's a really good point, because I talk a lot about really disclosing medical information, that communication. There's some people who do not want that information. So in palliative care, we train our providers to be good communicators. And we ask patients permission to give them hard information. We ask them what they want to know. We don't just come in, giving hard information if they don't want that. We truly respect each patient's wishes there. And then just thinking about other things we do for family members. We're trained to be good at prognosticating. So we can see signs that things may be going downhill and let families know before they would notice that, this is a significant change, that you're sleeping 4 more hours a day, or you've lost 7 pounds. And I think that's really empowering, and it makes stuff not feel like it's coming out of the blue when the changes happen.
One of the questions that I think oftentimes people wonder is, can you tell me about a story of how palliative care helped a patient with pain as well as beyond?
Sure. I think about a patient who I cared for. He had end-stage renal disease. He was on peritoneal dialysis. I received the referral because he was considering stopping dialysis. I cared for him for probably about a year, and I so enjoyed caring for him. He was a pleasure. Initially, I saw him once a month, and he wanted all the information. He wanted to know everything. He wanted to know exactly what it's going to look like when he stops dialysis. And we talked about that at each visit. And he loved existential conversations. He loved deep conversations. So, the biggest thing I provided him was that conversation. And our visits escalated to every 2 weeks and then weekly. I also managed his pain. He developed calciphylaxis, which is very painful. So we did manage his pain. He had a very labile blood pressure and would have frequent falls and declines. So being available for his wife to call us when she was worried was huge. And ultimately, he had a great deal of peace. And he had the last weeks and days that he wanted.
That's it.
His biggest goal was dying in his own bed his home with certain family members there. So it was planned the way he wanted. Symptoms were very well controlled, and the family and he had a lot of peace. I would like to talk about one other patient whose social work really impacted. So I had a patient with an aggressive melanoma, and we knew that it would likely spread, and it did. But our social worker, Casey Jo, got brought in pretty early in her care to help navigate some financial resources. Initially, that was how that started. As her cancer progressed, Casey Jo's care changed, and she started seeing her monthly, and then every other week, and then weekly. And they bonded over canning and baking and became friends, as Casey Jo does. Aww. And the big thing is this patient has told me and so many other people, I don't know what I would have done without Casey Jo. So it transitioned from financial resources to she helped her share the news with her family, talk through those conversations, filling out a 5 wishes form. And, you know, she was still getting cancer treatment. So we increased our palliative care support to weekly by alternating visits with us. And Casey Jo helped to provide that support during that time until she transitioned to hospice. And she just so helped her quality of life and the support of her family.
There's so much about both of those two stories that I really appreciate you sharing. And when I think about those two, I think about co-creating care. You and your team work together with each of those individuals and those that were important to them to find out what was most important. And, you know, as you said, you started on meeting with them at certain intervals, and it changed based on their needs. And that's really important for those listening to understand, is that when you start by receiving care, what you receive, how you receive it, doesn't have to look the same throughout the entire time. In fact, the conversation, the communication is going to continue every single visit to find out, okay, is there something new that you're thinking about? You know, we want to, when we talk about co-creating the care experience, you have touched on this already, but we don't want people to be worried or afraid. We want to say, hey, call us or let us know. It's reasonable to have a need to find out more. And if that's what someone has, we want to be there. And so I think that's so important, and it makes me so incredibly proud of our palliative care team, because our palliative care team, like our hospice team and our care navigation, our home care, and all of our team members throughout the organization, those providing care or supporting to make sure care can be provided, we genuinely care. Another thing that I love so much is we live in the community we serve. Like, that's huge.
It's so important for trust and navigating the resources of the county. That is very unique to Four Seasons, and it does make a very big impact.
Well, when we think about our palliative care team, I wonder if you could share with me, how could a patient or a family member check to see if they're eligible for palliative care? Because they might be listening and saying, well, I like this, and now I like it even more, finding out a little bit about the staff and that they live right where I am and they come right to me. But how do I even know if that could be something for me?
I would encourage them to start with talking to their primary care provider or specialty providers. And they can let them know if they feel like it's appropriate. If, though, they have a heavy symptom burden in a serious illness and there's a barrier to that referral being placed, they can self-refer themselves on the website or by calling in. We then request those records and review and make sure that we think that we are the right service and then schedule from that point.
Well, in our final time together, is there anything else you'd like to share? I'm just so grateful that you're with us, and I'm so proud of you and the team, because you really do provide excellent quality care. You really do provide trusted care. And when I think about the very purpose of these podcasts, it's to help improve access to quality care. And so in our final moments, is there anything else you'd like to share?
I think the only thing that I want to bring out a little bit more is that a lot of times folks can be scared of the idea of palliative care and hospice.
Yeah.
You can be on palliative care with life-prolonging goals of care, and we care for people who do not necessarily go to hospice.
Right. Absolutely.
So again, it's always the correct care for that patient and partnering with them. But thank you so much.
Well, it's an honor to be with you, and I'm very grateful for your time today. And just encourage our listeners, if you're wondering if this might be a service for you or your loved one, just call us. Thank you for listening.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.